should be right. It should be, life, liberty, pursuit of happiness. You can't be too happy if you're sick. I'm surprised it took as long as it took, and also the fact that it went through quickly.
And instead of the bipartisan bickering that we have going on right now, where you have Democrats, saying this is the greatest thing, Republicans trying to repeal it, I think we all should kind of need to come together.
In Canada, we've always needed government because our country was not as well populated, colder. We needed government to help. We don't have to buy insurance. It's just given to us and it's paid through our taxes. So if you go to a hospital, which is privately owned, but my insurance is taken care of because I paid into the system. I think healthcare is a life or death issue. I don't see how it's taken this long for Americans not to have some kind of solution to the problem of having so many people who are not insured. That's what I think.
Living in Vermont, we're very close. We're 2 hours away from the Canadian border. You go up there, you see the impacts of the health insurance up there. Vermont is one of the few states in the country that is moving forward right now with a single-payer healthcare system in which all Vermonters, almost 700,000 of us, will be insured equally.
Yeah, the more you buy in, the cheaper the pie.
And it's subsidized through my workplace, but then some of it comes out of my salary. So I guess as long as I've been working, I've been paying for health insurance.
If you lost that job, would you not have health insurance?
I'd have corporate for several months. By which point I would certainly hope I'd have another job.
I'm looking forward to getting health insurance for a more affordable rate. And also possibly getting into a group plan that I could get into that I wasn't able to get into before.
Do you think that everyone should have health care by the tax?
Yes.
Everyone should be taxed for it.
I was down there yesterday with Occupy.
Yeah.
I was down there with them yesterday.
What was that like?
We was in 6th Street Park and all that. I was down there with them. Gang went with them because the rich is getting richer and the poor is getting poorer.
Deserves it is an interesting word. I think everyone needs health insurance.
My feeling on it is everybody should be paying a fair share for their health care needs.
I agree with the Supreme Court that it is constitutional. In the same way I agree that the government also mandates that we have a standing army.
We take care of each other. It's like me paying for fire insurance so your house gets protected by the fire department when it catches fire.
The Supreme Court was right when they said this is a tax on a service everyone uses.
Well, one person calls it a tax, another person calls it a benefit.
I was gobsmacked.
Gobsmacked?
I was gobsmacked.
Great.
I was convinced from the language of the arguments that they were going to overturn the whole damn thing.
I was a union member for 28 years. I'm retired now, and my health insurance costs me about $200 a month as compared to his $1,400 a month. I also worked for the public health department for 28 years, so I understand why it's important for people who don't carry health insurance but can afford to have it should pay for it even if they don't want to, because those people are young and they're healthy.
Okay, who's first? Those children who have this pre-existing condition called leukemia? We had to set it up so that finally they can't be excluded. Can they be excluded now? Okay, all those who are willing to exclude children with leukemia because it's a pre-existing condition, raise your hand. Would you like to exclude? Okay. How about children with other kinds of cancer? How about women with breast cancer? Do you understand that pregnancy is considered a pre-existing condition in many policies, so that women who are or have been pregnant can be excluded from health care?
But then, of course, people are still be tinkering with the law. And as it stands now, the law was designed by a committee. And the joke about a camel is a horse designed by a committee.
It's great to finally be joining the ranks of every other country in the world that has universal health care. You shouldn't profit on suffering.
I retired from the Merion Hospital. I have Mercy Health through the Department of Public Welfare. In a way, it's good for me because I have my own personal doctor and I get treated for arthritis and stuff. If I was gonna pay that out of my pocket, I'm not Rockefeller, I think senior citizens should be taken care of by the government because I believe they have worked all their lives. I think they should get something in return because, if I worked already my entire life. I worked 38 years altogether. and I think I have paid my taxes like some people. Then again, there's a lot of people out there who don't want to lift a finger. They want everything in the palm of their hands, if you know what I mean. I'm not going to tell you I was being an angel, because I've never, I've done myself wrong things. There's people that they want to be on insurance, but then again, they don't want to go up there and even go out there and volunteer, help the elderly, cut the grass, or water the plants, what have you. Money is good. Don't get me wrong. I like money in case of an emergency, that. But when you pass on life, you're not gonna take it with you.
My name is Leo Alfonso. I am a school bus driver with Lower Merion School District. I've been a driver here for the last 5 years. I used to work part-time, coming from Philadelphia, where I was a probation officer with the district attorney's office, and I'm now here full-time. In my opinion, it's a good idea that that everybody in this country should have some kind of health care. I grew up in England and lived in Trinidad for the greater part of my life, and I know that in fact, it was a surprise when I came to this country and realized that everything was money in terms of healthcare. In England and in Trinidad, because we are British protectorate, we have free healthcare from a child up to adult. If you get sick, you go into the public hospitals, public health centers, and you get medical care. We're already paying taxes here. We get paid through our salaries. We pay by other means, like the house tax, school taxes. Why do we then have to pay more money to get better health care? I think that should be a part and parcel, because we are taxpayers, and that should be given to us freely. Well, I can't say freely, because everything we get here, we pay for it in subtle little ways.
My name is Ted Goldsborough. I live here in Ballackinwa, and I taught in the Lower Merion School District for 28 years, taught English. And I've been retired since 1994, and I volunteer for the Lower Merion Historical Society. We pay our health care. The Lower Merion School District doesn't pay that after you're retired. So a big chunk, like about 10% of our total income, goes towards paying medical benefits. And on top of that, we have to pay a copay every time we go to the doctor. It isn't much, it's $10 each time we go to the doctor, but our prescription plan, we do have to pay quite a bit. Like if you buy a bottle of spray nose drops, I did yesterday, it was $32 that I had to pay for one bottle. My sister, in 1944, when she was in 4th grade at Narberth School, contracted polio. Infantile paralysis is what it's called. Well, she's 75 years old, and for her whole life, she's had medical payments, medical expenses related to that. And even though she wasn't very sick as a result of that, because she had it, and it was on her records, her premiums for medical coverage were much worse than the average person. Guys driving down the road and somebody runs through a stop sign who's drunk. Well, why should that man be penalized for the rest of his life because he was hit by a drunk driver and he has leg problems or something like that? So I'm in favor of spreading the risk. I'm in favor of the government paying some, and maybe it'll even cut back on the $10,000 my wife and I are paying in premiums.
What did the turkey eat for Christmas? Nothing, because he was already stuffed.